Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I develop a lot of non-invasive technique for periorbital rejuvenation, endobrow, and today I'm going to talk about non-surgical and immediate facial rejuvenation. This is my curriculum. This patient comes from outside of my country. This patient was operated for another plastic surgeon that performed a conventional blepharoplasty. We can see here the scars and here the scar, but the conventional technique, blepharoplasty, with this technique it is impossible to rejuvenate the periorbital area. This patient was to send me for another plastic surgeon to perform a facial rejuvenation with carbon dioxide laser to improve the wrinkle here. But the patient needed no downtime. She needed to go on with his life, and I propose an interesting technique that is voluminization of the malar area. If you can see here, the malar, the cheek area have no volume here, and the distance of the lower eyelid and the lower eyelid cheek junction is very, very low, and it is very important in the rejuvenation of the lower eyelid to have a good volume in the malar area. The Egypts in the old time pay a lot of importance to the position of the eyebrow. As I said in innumerable videos, when the conventional resective blepharoplasty resect skin here of the upper eyelid and eyebrow skin, pulling down the tail of the eyebrow. Also, an important thing is the voluminization of the malar area, and there is no point of junction between the lower eyelid and the malar. It's just like an unit. Here you can see the voluminization of the volume of the malar area, and there is no point of junction between the lower eyelid and the malar, and this is beauty. Also, if we can see a nice woman models, and we can see the volume of the malar area is very important, and the continuation of the malar with the lower eyelid just like an unique unit. When we get old, the malar lose volume, and it is very important to return this volume to the malar. Also, this is an harmonization, because it's very important the aesthetic balance of the face, this volume. Also, we can see here the good volume, and there is no point between the lower eyelid and the malar. Robert De Niro, when he was young, we can see it's not good. This is the lower eyelid, and the malar is not nice. They have no the requirement of beauty, and you see when you get older. Also, Sylvester Stallone, this sad and somber expression is because the eyebrow is very, very low. The relationship between the lower eyelid and the cheek is very low. But we can see here, when he's old, have volume. This means that some plastic surgeon give volume here, but I need to perform a laser here and to pull out the tail of the eyebrow by endoscopic. But also in young patients, lack of volume this is racial. Here we can see, and we can see a little improvement with just removing through a transconjunctival incision the lower eyelid fat pads and also a little of volumization of the malar area. This patient needs more volumization to improve the aesthetic of this area. But generally, I perform fillers, and if the patient lives in my country, I wait 1 month and I perform another fillers. But when they come from outside, like the patient we are seeing now, I perform a lot of volume because it's hard to come back to Argentina. Here you can see the volumization. If we come back to the patient I'm going to present today, we can see the laser is good. She's not time now for the laser. She's going to organize her life for doing in another moment. But I can improve the lower eyelid, the malar. I can harmonize this. You can see here the scar, the conventional blepharoplasty, lack of the capability of improve this area, because just removing a thin strip here, you cannot rejuvenate the skin. The carbon dioxide laser is absolutely necessary in the periorbital rejuvenation. You can see here not only the wrinkles, but almost the lack of volume of the malar area. The idea of the volumization of the malar areas is not just only improve the malar, is just to shortening the distance of the lower eyelid from here to here, and trying to make just like a unique unity from the lower eyelid to the malar, as we saw in the previous pictures from the ancient Egypt and from the models today. Here we can see a sulcus, a deep sulcus, that is more important than this one. You can see here. And also I trying to harmonize the face, and I can see that here the chin is good, but here need volume also to fill this area, and also to make a little bit of fillers here to get the oval of the face. And with this idea I perform a treatment that lasts near 30 minutes, unpainful. The patient go out immediately with her ordinary usual with her life. And we can see the disbalance, and this is immediately after the treatment. This is a little red here because I use ice in order to be not painful and to produce a spasm of the vessels to reduce the possibility of hematomas and edema. But what you can see here is a long face, like Modigliani face, and here we can see the volumization of the malar, the continuation of the malar with the the lower eyelid. Here, this is the intersection of lower lid cheek junction, but here they are not lower lower eyelid cheek junction. It's just like one unit. And here we can see the effect of a facelift. It's just like a facelift, just only to giving volume with hyaluronic acid that are very safe. The only disadvantage of this hyaluronic acid is just lasts between 16 and 20 months, but they are very secure. We can see a long face, and here we have a face with oval. There is lower lid cheek junction. Here there is not lower lid cheek junction. It's just like a unit. Another in this profile, we can see a nice volumization all the zygomatic area. It's just like a facelift. Okay, I hope you enjoyed this presentation. I invite you to see the treatment that I recognize for my peers of periorbital rejuvenation without skin resection. Patients all around the world come to my clinic to perform this kind of treatment. Also, another plastic surgeon from outside send me patient to perform this kind of